Happy Monday, Angela.
Happy time change Monday.
Oh boy. We are going to hear about that today. I know I am anyways. Do you hear that a lot? Like people really affecting them?
Yes.
Yes.
100%. That's a circadian rhythm conversation to have for sure.
That's a great idea.
Yeah.
Yes, so today though we are going to be talking about a new program that I've been studying for, I think the first time I learned it was back in Nashville, which was in the summer, July maybe.
Okay.
So called Trigenics. It's, we'll get into kind of what it is, but it's kind of hard to explain, but it's a new form of muscular treatment that significantly gets results significantly faster than anything else that I've used.
Right. I have a personal experience because my son Angelo had torn at the beginning of the year his meniscus and ACL, and then underwent surgery and then even physical therapy. And when you treated him with this method, it was kind of crazy what came out of it. So the physical therapists were concerned at the time because he was still walking with a limp. It was almost as if he was really still trying to protect himself, and even as he was progressing. And when you got a hold of him, can you explain what happened? Well, I can tell you what happened as far as what I saw. So you applied the treatment and this method of working on him and working on his knees and the muscle group around his knees. And all I can say is that not only the next day, within the next 24 to 48 hours, was he not limping anymore, but I was having to tell him not to run.
And I remember, because that's been a while ago, and I remember there wasn't a lot. I was expecting there to find more with what he had going on, but I didn't have to do a lot with him.
No, not a lot.
Like
at all.
there was just a couple of things, and that's what I really like about this. And so,
what's happening? Take us through.
Yes. So what is
happened?
happening? Yeah. So it's interesting because Trigenics, and I'm learning this, right? So I'm certainly not an expert on Trigenics, and I'll probably butcher this a little bit. But Trigenics, what's different about, so I say it's a muscle technique, right? It's actually a neurological technique.
Okay.
So oftentimes when there is some kind of injury or insult to a joint or even a muscle, your brain's response is to shut everything down, right? Curl up into a ball is the most common. And so when you do that, certain muscles become hyper facilitated and certain ones become weaker.
Okay.
And so instead of just trying to stretch a muscle that is neurologically tightened, or to try to exercise a muscle that is neurologically turned off, you're going to get really short-term results, but get really frustrated because those don't equate to long-term changes, right? And I see this a lot chiropractically. People come in, hey, I got a massage, it felt really good for a day or two, and then the problem came back again. This is the same sort of issue with more joint-related injuries. So specifically what I have studied is knees and shoulders, but a lot of the knee issues are actually coming from hip issues or feet issues. And so now I've got a tool to address feet, knees, and hips, and which translates into lower back and pelvic issues. And so what really turned me on to this technique is the neurological side of things, because I would rather send someone out to address the muscular side of things, right? Go see a physical therapist when you have actual deficiencies or imbalances. or you need some electrical stim and ultrasound, right? Like, that's not I don't love doing that. So I would much prefer to, hey, physical therapy is going to work great with what we're doing. Let's work in tandem with that. Or here's some things you can do at home on your own as far as exercise goes. But I know from my experience, if the neurology to those joints and muscles is not what it's supposed to be, then it doesn't matter how much you stretch or strengthen a muscle. It's going to keep coming back and keep causing problems again and again and again.
Wow. So how is it rewiring the brain to actually address the actual joint, or to actually turn on what's turned off, and then actually alleviate what the insult is?
So Trigenics means 3. So it uses three things in combination to basically reset the cerebellum in your brain, which is your cerebellum is what is responsible for motor control, right? Balance and when you can walk a straight line, that's your cerebellum kicking in and making sure that you know where you are in space, and controlling the right muscles to do that, and joints. So tri means 3. It started, so take a step back, it started actually back in the 80s. So it was, Dr. Austin, I don't know if Dr. Kingsbury he would be a blast to have on here. He's got so many,
him on here.
He has so many stories on this stuff. I was actually thinking of that yesterday. I'm like, we should interview him because he would run away with this, just telling stories. And so he was taught by Dr. Austin, who was the originator of it. Okay. So Dr. Austin started it back in the 80s. He started combining trigger point therapy with movement, and was getting much better results than he was traditionally getting with people. And so he took that concept and kept running with it. And so there's 3 components that all work in combination and do a phenomenal job at resetting the neurological side of things. So number 1 is you're doing resistive exercise neurology. So depending on what muscles are involved, the patient is actually moving the muscle or the joint through a range of motion, and we're either preventing that range of motion or we're resisting that range of motion, depending on what's going on and if it needs lengthened or strengthened. So exercise of movement as part of that joint is number 1. Number 2 is basically a nerve sensor manipulation. So we're working, we're pushing on, we're manipulating either the tendon or the belly of the muscle, again, depending on what we're trying to do, so that the brain feels that it's sending messages to your brain that says, look at me. There's something going on here, right? The joint's moving, we're pointing the brain to that area. And then the third component is breathing. So we've talked about how important breathing is, but oftentimes muscles are being overstimulated or shut down. And so we always have the person breathe out as we're doing this, which again triggers the brain to say what's going on, let's look at this muscle. It's almost like hitting Control-Delete on your computer. Your brain says, okay, there's 3 different stimuli into the same muscle. Let's reset what's happening to that muscle. And when that happens, then it's not being shut down or over-facilitated. You can start to get those ranges. And as soon as that happens, your body knows what to do, right? And so it's easy to restore the proper length or strength to those tissues. It happens a lot more quickly. So 3 things.
Wow.
Yeah, it's a lot.
It's a
I'm
lot,
trying not to
and
make it.
It's cool, and and by the way, it's not the most comfortable thing
No.
to go through, but so very, very, very worth it. So talk to us about. So I've had a treatment myself too, because during a workout I had definitely I'm not sure what I did exactly to my hip flexor or my psoas. I'm not sure even which one it was. Maybe you can enlighten a little bit. But I wasn't activating my glute when I was actually trying to do step ups on a step. With weight engaged, so my glute wasn't engaging the way it was. So unfortunately, my hip flexor or psoas took the hit for that, and then I came in the office limping myself.
You were dragging your leg. I said, "What did Mike do?" Yeah. So, yeah. In your case, so you'll see oftentimes both of those concepts. So a muscle being shut down and a muscle being over facilitated at the same time, because those two muscles can't be doing both at the same time.
Right.
So if I am bending my arm to flex my bicep, my tricep has to turn off to let me do that.
Okay.
If I extend my arm to contract my tricep, my bicep has to turn off. If the neurology to my bicep doesn't let it turn off, then my bicep is always more tight and what we call over facilitated, and so I can never get a full range of motion into my tricep. I can get a little bit, but not a full range. And so when we take somebody through range of motion tests, or commonly, like one of the biggest conditions that we can treat with this is frozen shoulder, right? We've seen people who can barely lift their shoulder up,
Right.
and that's because certain muscles are really, really, really overactivated, and so the other muscles are turned off, and so you can't physically move your arm out further or as far as you should. And so that's sort of what's happening is certain muscles, and so it's pretty easy to start to tell, right? Like I had you do a really simple, can you hold your leg up? And you couldn't even hold your leg up.
I couldn't.
Right? You can walk, you could, you could do step ups, but when we isolated that muscle, you could not hold your leg up. No. And so when we turn other muscles off, strengthen that muscle, 10 minutes, you're holding that leg up. Not as strong as you should be,
Right.
but now you can, and
Right.
like it takes time for those tissues to heal
It
as
does.
well. And so,
But the amount of pain that I was experiencing definitely decreased within a 24-hour period, where I would have probably been walking around like that for weeks.
yeah, and you mentioned that the treatment itself is not not that
you
pleasant.
have no choice but to breathe through that.
That's okay. Yes, that's fair. Yes.
And I remember Dr. Kingsbury saying, this is one of the only times where it will hurt.
Yeah, you're right. Temporary pain to get some long-term benefit. But the good thing is it's a hurt so good.
Yes.
Right? Like it's not, oh my gosh, you're hurting me.
No.
It's, wow, I can feel that muscle.
Yes.
That's exactly where the pain is.
Yes.
That's exactly where the problem area
Yes.
is. Or, wow, I had no idea it hurt there.
Right. Yes.
Until, you start pushing and poking around,
Right.
and it's like, wow, I had no idea. I think it also addresses, I don't know how often you get this, but one of the questions, I was actually thinking about this a lot over the weekend and last week. One of the most difficult questions I get, and I get it probably every day is why is this happening?
Right.
What caused my shoulder to hurt? Right? I didn't tear it trying to throw a baseball 90 miles an hour, right? Like I just turned around and picked up something off the floor and from the back seat of the car. What caused that? Or they just woke up and why did this happen, right? And this this process helps us start to figure that out a little bit more. Previously, unfortunately, or even when I'm looking at somebody's X-ray, it's so difficult to say, right? Like, I can tell you what's happening right now, but as I look at the course of the last 5 years, like I can't pinpoint one thing that you did to aggravate this. I mean, the example would be Angela. I'm 20 pounds overweight. What meal did I eat that caused me to gain 20 pounds?
Wow.
Right? It's the same concept, right? Like, it's not one thing that you did.
One isolated.
It's sitting at the computer for this long. It's, it's all of these little life things that have added up over 5, 10, 15, 20 years. And then you bend backwards into the back seat and you tweak your shoulder or you do something to your back, right? Like, it's not one thing that you did, right? It's not one meal that you ate that caused you to gain 20 pounds.
Right.
I mean, I don't know. Last night I felt like I did that, but that's not the case. And so this, what I really love about this process is it allows us to start to see those patterns, and then we can start to say, okay, maybe it was an injury, a specific injury, or maybe it was, we're seeing this pattern develop. What are you doing that puts the shoulder in this motion? Oh, I'm, at a mouse all day, or I was cranking the wrench, anything, right? And so it helps us to be able to pinpoint that a little bit more. And also speaking to that, it also gives us some tools to be able to address a huge range of ages and problems, right? So Angela's in high school. I worked on my niece who just started middle school track over the weekend. We can work with people who are 60s, 70s, 80s and have degenerative shoulders and knees, right? Mark, the guy that we've seen, huge changes. He's shot basketball over the weekend.
Wow.
Right?
And to me, like, the second he said, like, I was actually able, like, to hold, like, my grandchild. Like, I was like, wow.
He is one we should also get on here because he has literally tried everything else. So it would be fun he's a character too, so it would be fun to get him on here and get his take on, because he's incorporated nutrition and chiropractic and decompression and Trigenics, and so kind of seeing how all that has fit together for him. So so I think that broad range of being able to work on people is fun for me, and it's great because it's not just something that's for athletes. It's for people. I heard a great quote not long ago that every body is an athlete, right?
That's right.
And so that really resonated with me because I think we've talked about it on the podcast, but one of the most common things we hear is, man, it sucks to get old. Right?
Oh, they'll tell me, yeah, you hear it all the time. Well, you hit this age and it all goes downhill from there.
That's right. That's right. And so to reframe the way we're thinking of that, and to have some of these amazing tools to be able to keep people playing tennis or pickleball
or working out, like
moving,
yes.
gardening, playing with their grandkids.
What a compliment too, like to someone who's really looking to be in the best shape of their life at any age.
Yes. So, the other part of this that I've really enjoyed, or I think has fit into specifically my strength set. I was thinking about this yesterday as I was recording the podcast. There's a really great story. It's not really a story. It's almost, I won't say parable because it's not biblical, but it's the...
allegory?
Something,
is that right?
Possibly.
We'll have to look that up.
So the guy who really started chiropractic, he wrote about it in a series of books, but he talks about how, a slip on a sidewalk is a small thing. Falling off the ladder is a small thing. But over time, and when you compound that by, a lot of people, that becomes a big thing in how people are acting and behaving and what happens to the healthcare system. But more importantly, to that person, it's not a small thing. It becomes a big thing, right? Because slip and a fall on the sidewalk can become dis-ease, right? And so correcting that, right? Like helping someone's shoulder or knee feel better is a small thing, but to that person and kind of the ripple effect it has, it becomes a big thing.
It's a very big thing.
And so I think that plays a lot into, also on the podcast before we've talked about superpowers. I think this plays tremendously into my superpower in working with people, because I have an ability to look at the way someone is standing or look at the way they're walking and not just say, okay, I see what's going on with your shoulder, but we can start to trace it back to say, okay, see how your foot's turned in, that's doing this to your knee, certain muscles are activated or not activated and you're putting stress here, your hips are doing this, your shoulder's compensating here. Like, I think because I took engineering, that has served me really well in being able to understand how a problem with your foot could be causing your shoulder issues.
Exactly.
Right? And so, yes, we want to address your shoulder issues, but we also want to address the rest of what's going on.
That's right.
And that's honestly, in my experience, what people are searching for. Because if you need shoulder surgery, then yes, go to the specialist who only works on shoulders. But if you don't need surgery, but you want to start to function and feel a lot better, let's fix everything that's causing that shoulder pain, right? And most of the time, the shoulder guy is not finding all of those other things because he's so focused on the shoulder.
Right.
And so if we can address those other things, then we're getting to what the real problem is.
Right.
And so I would say that is probably one of my biggest strengths in working with people is for some reason I can look at somebody standing in the line at the grocery store and I can tell you probably 3 problems that they would confirm that they have just based on looking at them. And so I think this has brought that awareness up of like, okay, this is how I know that, and this is actually a lot, some really powerful tools on being able to address those things.
Yes. Yes.
So the way that I'm starting to use them in the office, and what we're going to start to roll out over the next couple weeks is really focused on shoulders and knees. I'm also incorporating this into decompression and some of my other regular chiropractic stuff, but the treatments for these takes time, right? And so it's really not something that I can just do the way we have adjustments scheduled, it doesn't allow the adequate time to be able to do a longer treatment. And so we're starting to adjust the schedule, and we're starting to block out more time to be able to do these treatments with people. And so we're trying to figure that out, right? Like, that's a change, that's a process, that's, you know, how does that work at the front? Do they know how to schedule? And, you know, the last thing I want is for people to be sitting in the waiting room for 30 minutes because I did Trigenics on someone, right? But the treatments are 20 to 30 minutes, and we're combining this with Rebuilder, which is an amazing tool that will help kind of, again, reconnect the brain with the neurology around certain joints. We're combining it with a beamer, which is pulsed electromagnetic frequencies. We're doing a lot of kind of different modalities that people are not used to getting to try to get really quick changes in results. So ideally, if somebody has frozen shoulder, we're able to see huge changes in that in like 4 to 6 treatments, which, you know, oftentimes that can be months and months and months of physical therapy. And so for us to be able to elicit that kind of change quickly is really cool, right? It's really awesome for the patient. But it's different than what we've been doing. And so I need to figure out, like, what does that look like? And there's a program for it, and it will be expensive because it's time intensive, and there's a lot of things that we're doing to it. But what's it worth if you have frozen shoulder to get that taken care of in a month versus a year?
Crazy.
Right? Like, there's value to that. And so we're working through all of that.
Yeah. We are. Okay.
I'm excited though.
Me too. It's good stuff.
Yeah, so be on the lookout for that. If you have any questions on what Trigenics is, I'm happy to try to help. If you have questions on if Trigenics can help you with something specific, or your student athlete, or your grandparent.
Right, post-op.
Post-op's huge.
Huge.
So we'll start to dig into some of the case studies and different ways that we can use this approach a little bit more on the podcast. So we should also post some videos of what it actually looks like.
That would be great.
Yeah. So great. Yeah. Well, we're gonna pick back up next week with my food allergy results. Can't wait for that. So until then, have